Chain Drug Review, and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello, everyone. I'm Jeffrey Wolt, Editor-in-Chief of Chain Drug Review and Mass Market Retailers. Welcome to our video forum. Today, we're delighted to bring you the second installment of highlights from the recent Health Equity Forum, co-sponsored by Kearney and Chain Drug Review. Today, we'll get Kearney's perspective on this important issue from Karen Yockey and Laura Bowen.
Even more sort of inspiring is we've seen a lot of regulatory changes and programs recently that are advancing health equity. So the FDA has come out with clinical trial diversity guidelines. CMS has added the Health Equity Index, which will start to be tracked in 2024. And then we also have programs through the White House and the Department of Health and Human Services. And these are just a few examples. And while there are pledges from companies in support of some of these programs, it can't just be a government-led thing. Everyone here has a role to play. What's great to see with the folks in this room is that you're representing across multiple different stakeholders within the industry, across government, across private and nonprofit. And it really is key to be partnering and collaborating across the spectrum. We've heard this today. This was our biggest takeaway last year. And it really can't be emphasized enough that there needs to be collaboration and partnership in order to accelerate forward. So how do we sort of ensure that health equity going forward is central to an organization's thinking and kind of goes into the framework of decision making for everything that they do? And this is where it gets exciting. So a lot of kind of common thinking around health equity is, oh, it's an investment and it's for the good of the community, but it's not necessarily beneficial to my business. But in actuality, what we see is that there are several different cost-saving initiatives that actually can improve health equity. So as we look at processes, streamlining workflows and processes not only saves cost, but it also allows for providers to be freed up to offer more tailored care. In the Women's Health panel earlier, we heard they often only have 6 minutes to see a patient. This would allow much more time to really be able to diagnose and treat the patient effectively, as well as saving costs. Proactive and early intervention, especially for those underserved and at-risk populations, while it's an investment up front, it does prevent significant longer-term costs of care. More efficient resource allocation will allow for more widespread serving of populations that are underserved and may not be benefiting from provider resources and where they're currently allocated, and also allows for the resources to be deployed more effectively to where they're most needed. And lastly, care coordination across the continuum of care improves equity and improves quality, through value-based care, as well as sort of reduces redundancies in terms of the care that patient is getting. So how do we start to transform the thinking and the mindset that health equity is something that is good for communities and it's good for business? Shifting from, this is a philanthropic effort that really has nothing to do with my profitability long term, to this is part of my core business and not only is good for my communities, but it's also good for my business. From thinking this is kind of a one-off initiative that is doing good for the community, but it's kind of its own silo, to really thinking about this is something that is holistically, should be holistically considered across my portfolio. And then from thinking about what's going to give me immediate returns to what's going to actually lower my long-term cost structure. So it may be an investment up front now, and we may not see returns immediately, but there will be significant return in the next couple of years. And these mindset shifts really do create great outcomes across the organization. So allowing for a more comprehensive view of how health equity can benefit the business really allows for bolder thinking and more innovative ideas, and freeing up that mind space to say this isn't going to happen right away necessarily. In some cases it might, but we're not going to see those returns right away, but we know down the line we're going to see a lot of benefit. Allows you to think more creatively and innovatively about what's best for the community and what will the long term be best for the business. We also heard earlier today that healthcare workers are suffering from sort of a lack of purpose in what they're doing, which is driving a lot of attrition. But bringing that health equity objective as something that's intrinsic to the company will allow you to have greater employee satisfaction. They're realizing they're doing something for a greater purpose. There's also more commitment, and then drives more retention, which we know has been a significant issue over the last few years in the healthcare industry. There's also rethinking of delivery models and kind of rethinking what's efficient and what's best allocated within the company, and thinking differently about where those resources go.
So we've seen this in a few different industries that have navigated, as Laura said, this kind of balancing of equity and efficiency to improve outcomes as well as expand their services and footprints. So one example is in banking. Bank of America works with community development finance institutions, and through these partnerships, they're able to provide access to capital to those that may not traditionally have it. They work with nonprofits, affordable housing developments, small businesses. And so again, in doing this, they're giving that access to underserved communities, but they're also expanding their own scale and footprint. Another example being Aldi's. So Aldi is a grocery store that really focuses on efficient design. So their store design, they don't use expensive shelving, they use more pallets. They have a limited product selection or more private label products. And in doing this, they can keep their costs low while maintaining quality, but also expand their footprint to rural and underserved communities that may not have access today. And then finally, thinking about telecom, Vodafone has been an interesting example. They've used solar-powered cell sites and microwave transmission systems to bring coverage into areas that may not have a traditional power source, may have unreliable electricity, or where it may be too expensive. And these are low-cost ways that they're able to provide coverage in these rural areas, while again continuing to expand their own footprint and network. How do you operationalize this in your organization? And, we've talked about balancing efficiency and equity. We know that taking a mindset shift is really the first step, but how do you really bring an equity-led approach to your organization? And we distill that down into kind of 4 elements. So one is segmentation. So how do we use segmentation analytics to make sure that we're prioritizing the populations that are of highest need and where we can have the biggest impact? We can't do everything for everyone, and so using those analytics to make sure that you're focusing on where there's the greatest need can help you have the biggest impact. Second is around innovation. We know the healthcare system today isn't meeting the needs of these patients. So what do we need to change about the way that we deliver care to better meet those needs? Third is then in terms of optimization. So how can we continue to serve these segments sustainably and profitably for the long term? That's going to be critical to making sure that we continue to meet that need, meet them where they're at, and provide and develop the operating models that can support that structure. And then encompassing all of this is really monitoring and evaluation. So with every step along the way, we really need to be thinking about, are we meeting our goals? Where are we falling short? And what do we need to change to be able to deliver it better? And so this goes beyond thinking about your typical financial returns, but also how do we measure the economic value of the social returns and the outcomes that we're driving? So Kearney has a framework, our social return on investment method, that really helps you think about how do you measure the full value chain of impact that you can have. So I'll just quickly walk you through an example. For a newborn development program, so we start with thinking about beneficiaries. So we have a mom and a baby. They're participating in a program together. What are some of the activities they're participating in? Could be lactation services. What are the outputs of that lactation services? It could yield them better nutrition. And then what is the outcome of that better nutrition? It's better health over the lifetime for that child. And so then we develop a set of indicators or metrics where we can really measure those outcomes. So thinking about, cost avoidance of, not better nutrition means less illnesses later in life. So there's cost savings there. We can calculate kind of all of those incremental benefits against the cost, and then really get to that kind of social return. And so this is actually a real example. We did this for a hospital where we evaluated their newborn development program, and we were able to see an 18.3 social return on investment, meaning that for every dollar that they invested, they saw $18 in social returns. And so I think expanding our way of thinking to say not just the financials, but the economic value of those social outcomes really help us think bigger about the impact that we can have.
Please join us next week when we begin to delve into some of the panel discussions involving retailers and other healthcare stakeholders.